Good morning, everybody, and welcome. I'm delighted to see everybody here. My name is Cara Carter. I'm the Senior Vice President at the California Healthcare Foundation. Thank you for joining us today for what I am confident will be an important conversation about artificial intelligence in healthcare, and more specifically about what Californians themselves think and feel about it. At CHCF, we work to improve California's healthcare system so that all Californians have the care that they need. We focus especially on making sure the system works for people with low incomes and communities who have traditionally faced the greatest barriers to care. One of the ways we do this is by listening. We believe that the people who use the healthcare system, patients, families, community members, have critical insights that can and should shape how healthcare is delivered. Over the past several years, we've conducted listening projects with Black Californians, Latino Californians, people with complex needs, people experiencing homelessness, and many other communities to understand their experiences, their concerns, and what they need from the healthcare system. These conversations have fundamentally shaped our work and our investments. They've also helped us understand what matters most to the people we serve, and they've held us accountable to centering their voices in everything we do. Today's conversation continues that commitment. As artificial intelligence becomes more prevalent in healthcare, from scheduling appointments to supporting clinical decisions, we wanted to hear directly from Californians about their perspectives, their concerns, and their expectations. This isn't just about technology. It's about trust. It's about equity. And it's about ensuring that as healthcare evolves, it evolves in a way that serves everyone, especially those who have been historically underserved. And now I'd like to introduce Stella Tran, Senior Program and Investment Officer with our Innovation Fund, who will share more about this listening project and what we learned. Stella?
Thank you, Cara. Hi, everyone. I'm Stella Tran, Senior Program Investment Officer at the California Healthcare Foundation. I'm on our Innovation Fund team, where we focus on technology as a lever for improving healthcare access and quality. We've been supporting AI implementation across California's safety net in clinics, public hospitals, health plans, and other delivery organizations. And from our partners, we hear cautious optimism. They see AI's potential to address critical challenges like administrative burden and workforce shortages. But they also recognize the risks and the imperative to implement AI safely, equitably, and in service of patients. So here's what we know. Patients and their perspectives will determine how successfully healthcare adopts AI. Consider this example. If clinics use voice AI to support appointment scheduling, but patients don't engage because they're concerned about how their voice will be recorded or used, we won't realize the tool's full potential. Their trust matters, not just ethically, but practically. When we build trust through education and transparent consent, we create the conditions for both patients and providers to benefit from these tools. That's why we conducted this listening project, to understand what Californians think about AI in their healthcare and to share those insights with delivery systems across the state. We hope this work catalyzes more conversation and more listening. Before we dive into today's content, I have some important housekeeping notes. So first, this webinar is being recorded. As always, we will send the recording and all resources shared today via email within the next week. Please submit your questions in the Q&A tab. We'll get to as many as we can. And finally, at the end of the webinar, a brief survey will appear on the screen. We'd greatly appreciate your feedback. And now I'll turn it over to Michelle Cordoba, Founding Director at Culture IQ Group, our partners in this work, to share what we learned.
Thanks, Stella. So we're going to get right into it. We have a lot of information to cover. Welcome, everyone. And again, like Stella said, there'll be questions and answers throughout. I'm going to run through it as quickly as I can. So let's start with the our key findings. Next slide. Thanks. So basically, we did this large study of qualitative study, and what we heard from a variety of people were that they wanted to understand how AI was being used. They wanted to, in order for them to trust it, they wanted to know that there was transparency in the process and that people, actual humans, had control, right? They wanted to have, to feel that the human connection between a patient and their healthcare providers was central. And cultural and racial context matter for the adoption of the various AI tools that we studied. Also, the digital divide really affected perceptions of AI, which is to be expected in terms of understanding and also practicing or using the tools. And the applications that received the most support across the board were those that were administrative, that dealt with shortening wait times or navigating the insurance system and things like that. So I'm going to take you back, next slide, please, to where we started and how we started building an understanding of where people were in terms of AI, and then how they felt about applications to the healthcare field. Next slide. So generally, most people had some familiarity with AI, right? They had experience through work or school, or they'd seen it on social media. A lot of people told us, oh, Siri or Alexa, or I've used ChatGPT at school or at work to generate a report or to do research. We heard the word research a lot, that people were using AI to do research online. The lowest awareness were among older adults, respondents with lower incomes, and those who preferred a language other than English. And a lot of people noted that they felt that AI had been increasing kind of in the zeitgeist over the last couple of years, particularly in news, movies, and other entertainment reporting. So when we talked about AI, overall, people expressed the need for balance. They wanted to balance the benefits of AI, like accessing and managing large quantities of data, generating content, achieving more efficient outcomes, so that society could enjoy, the benefits of it. But they also wanted that the risks of integrating AI into daily life, like inherent bias or lack of human judgment or experience in decision making, job losses, and eventual replacement of humans, they wanted those to be diminished or avoided. So after talking, next slide. Thanks. After talking about the kind of AI in general, we moved on to a discussion about healthcare. Next slide. We screened respondents to have had at least one interaction with a doctor or other professional medical provider within the last year. We did find that most were insured, either through Medi-Cal, Covered California, some kind of employer-provided insurance, or Medicare. Several of the lower income respondents talked about going to community clinics for health services. Overall, they talked a lot about having a personal relationship with their doctor or clinic. They really valued continuity of care and people like having access to their medical history, their medical chart. That was really important to a lot of people, is that someone knew what was going on with them and that they didn't have to repeat it all the time, each time. The people who most trusted the healthcare system had these empathetic, attentive providers, even if they weren't the same provider every time. And they were perceived to be kind of knowledgeable and up to date with what was going on in the medical field. Those who tended to have the least amount of trust in the system were people who had dismissive doctors, had had problems with diagnosis or delays or errors, people who had experienced a lack of transparency in billing or charges, and just people who'd had kind of had an overall, bad feeling about insurers. We asked them how aware they were of what was going on with AI in healthcare. Do you know any kind of AI applications in healthcare currently? Most had heard about something. They talked about automated phone systems and helplines, and some people said, well, I've heard that they can do early cancer detection with AI, that you can have, medication administration, or you can try on glasses, virtually. And a lot of people mentioned robotic surgery, so they had heard about that. But when we asked them specifically, what had you experienced? They said, well, I've seen my doctor have a laptop or have a tablet in the visit. Several mentioned that they had either had or been offered AI to help interpret mammography results. When we asked people about how they felt about those tools being used, some, really felt very optimistic that, hey, that this is like cutting edge, it's technology, it's going to improve diagnosis, there's more precise surgeries, that's got to be a good thing, maybe some, better customer service. But the prevailing sentiment really was that AI is at its best when it's a tool that doctors can use to do their jobs better. That once it moved into the realm of replacing human interaction and experience, that was not a good thing. They also had some concerns about data privacy and security, and this loss of human interaction. And they worried that the doctors might become over-reliant on these tools, doctors and other medical professionals, that they might become over-reliant and not stay as up to date on what's going on in the world because they're kind of depending on this machine. We did hear machine robot a lot. And when we were having these discussions, we did hear a lot of people say, so what is being used right now? Is AI being used and I don't know about it? Kind of what is, now that I think about it, what's out there? So that was an important thing to keep in mind in terms of, some potential uncertainty, but also apprehension around AI in healthcare. And throughout the study, we found that the preferences and concerns about AI applications in healthcare across particular groups were largely reflected that group's experiences in the healthcare system. So we found among our Asian American respondents that they valued respect, dignity, and independence, family-centered care. So these are going to be things that they have at the top of their mind when they're evaluating an AI tool, right? And kind of the lens through which they perceive the tool. Similarly, our Hispanic Latino respondents, really highly valued empathy and connection. They wanted in-person visits and they wanted trusted providers. So again, their demand for trust is quite high. So their demand for trust with AI tools was reflected that. Among African Americans, there tended to be, our respondents expressed a lot of distrust in the healthcare system. They had either personal experience or had seen their own family members, or they'd heard anecdotes about being misdiagnosed, dismissed, undiagnosed, just overall not listened to. So that distrust of the system overall tended to color kind of how they felt about these tools we were talking about. Similarly, older Americans, very much less technologically savvy. There was kind of a fear of being left behind by technology. So they needed more patience, reassurance, and clarity around these tools than other respondents. And those who preferred a language other than English expressed a lot of shame and fear of misunderstanding around being at the doctor or being in a medical setting and not feeling seen. And so those things kind of shaded how they felt about AI as well. Next slide. So respondents were presented with a variety of real life situations. Oh, you can go to the next one. Sorry. Thank you. That depicted current applications and potential future scenarios where AI could be used in a healthcare setting. So we showed them interpretation services, scribing, AI-powered screenings, AI front desk and triage, prior authorization, and predictive analytics. And we basically, we showed them a little picture like this and a little description, and we talked about, their impressions of each of these individual scenarios. It's really important to note that this despite the visual and the explanation, which was written and and we talked them through it. These scenarios really had to be explained in detail before they were able to even kind of understand the most basic function of the tool. What they really wanted to know and understand, and what some of them had a difficult time grasping, was how the application worked, what the robot did, and how the doctor was involved. So they really wanted to understand the interface between the tool and the human, right? The person that they trust. Thank you. So overall, we had a wide range of positive reactions. Like people immediately said, "Oh, these, are some benefits that I can see to these tools. Primarily improved efficiency, that is more complete, accurate records, shorter wait times, more appointments, that kind of thing. So, it could be so much more efficient, right? It could help make things so much more efficient." Improved accuracy in both diagnosis and treatment. So they talked a lot about reducing human error, that, machines don't get tired. The human error might be less, and they would give time. If doctors weren't doing all these kind of routine administrative things, then they could focus more on their patients. Also improved communication. This happened a lot among our non-English speakers, or those who preferred English, preferred a non-English language, because the translation tools would allow them to speak more freely, and it would reduce the risk of misunderstanding, which can lead to misdiagnosis or lack of diagnosis. And then there was some conversation about some potential cost savings, that, administrative tools could help us, navigate the insurance process, or, if there were any efficiencies to be realized, that might end up being some kind of cost savings for patients. Next slide. On the negative side, which again, these didn't come up kind of, they came up very spontaneously. This is something that'd be really great about it. And then someone would say, "Oh yeah, but what about this?" So, one didn't have any more weight than the other. They just were things that people kind of expressed as we were going through the scenarios. But one thing that came out kind of loud and clear in each of the scenarios was about data security and privacy. So who has the data? Who's keeping the data? How is it being stored? What's security? And are my HIPAA protections, still going to be, valid when there's some machine, right, or robot that has the data? There was also concerns about inaccuracy in diagnosis and treatment. And that was really generated from this, like, how reliable are the tools? Who wrote the code? How involved were doctors in writing, these and testing these codes? And then there was a concern about, whether actual practitioners would be eventually replaced, that there would be no human involved in the process. And there was a strong feeling that would lead to inaccuracy. Reduced communication. So there was always kind of in the back of not in the back of everyone's mind, but kind of right there, what people were thinking was that they preferred human interaction, particularly in health-related situations. So, once you're relying on a machine, once you're relying on a tool, are you losing communication instead of getting better communication? In the translations in particular, it was, can these tools, it wasn't about using a machine for translation. It was, how good is the machine, right? How good is the tool? Can it capture nuances? Can it capture, regional differences or nonverbal communication? Those kinds of things. And also a fear that, doctors could become over reliant on it and less engaged with patients. And then on the quality of care side, it was, magnified inaccuracy and bias. Who's writing it? What information are they using? Are we just making something that's already bad worse? And then a pretty healthy dose of skepticism that if there were cost savings, would that be passed on to a consumer, or would that really just enrich the insurance companies, the corporations, the doctor groups, those kind of things. We asked them, what would it take for you to feel better about these tools? And what we heard was human oversight, right? Auditing, review, testing, reporting, knowing that there were humans in the medical profession that were constantly testing these tools and assessing them, making sure that that they were working as intended. Also, implementation of robust data privacy and security measures, right? So they wanted to know what you're going to do about it, and what are the things that are the measures that you're going to be taking to make sure my data is safe. Ensuring that patients are informed when AI is being used, and also being given the opportunity to either opt in or opt out. So again, as I mentioned earlier, this kind of uncertainty about, well, what's going on, and not knowing whether AI was being used or not. The involvement of medical professionals in the process, and including, and this came up quite a few times, including a process for complaints and grievances. So if you're going to have automated systems, if you're going to have, tools that, help with prior authorization, who's going to be there? What human is going to be there if it goes wrong for me? And also making sure the technology is available to everyone. That is that there's equal access and equitable access to these tools that may benefit people. So that was a lot of information. There's quite a few, quite a bit more in the full report. But what we did distill down to is kind of a couple of areas where we feel is the most important for practitioners, and some recommendations of what to do. So first is patient education. So what we heard kind of over and over again is that, how this technology works, how the doctor interacts with it, and how the patient might benefit were key points that are absolutely vital for patients to understand in order for them to accept the tool, right? So our recommendation is to create patient education materials, and that could be anything, depending on who the patient group is. But videos, interactive tools, brochures, emails, just featuring the tools being used in settings that are really familiar, and including this very specific explanation of how it works. With, kind of with the lens of, or, through the lens of, this is empowering providers, not replacing them, right? And talking about oversight, and talking about that the patient can save time, get better results. Building trust. All of our respondents talked about having this human-centered vision of healthcare, that they really valued these strong connections, and, clear interactions, face-to-face interactions with their practitioners. So they most embraced those tools when they were those tools that were seen as like helping foment that relationship, right? Taking away administrative work from the doctor, providing a translation, speeding up, the insurance process. They understood those. They saw the benefit of them in the context of, this can help the doctor help me. And the concerns weren't really about AI itself. It was about the way that AI could be used or misused, or used too much, or used in a way that wasn't transparent, that would harm that central doctor-patient relationship. So communicating about AI tools should really focus on the benefits, how the doctor-patient relationship is supported, how it helps practitioners do their jobs better, and again, improving patient outcome. And finally, informed consent. So, we've talked a few times, I have talked a few times about, patients wanting to be informed, either in advance or at the visit, about what kind of AI is being used, and what precautions are being used to protect the data. And they said they wanted to be able to opt out. Although when we asked them, if it was happening now, would you opt out? And most of them said no, but I would want to know that I could. So sometimes it's not practical or possible to get informed consent for the use of some of the AI tools. We do recommend that whenever possible, there is some explanation during the explanation of the tool itself to explain the process for opting out, right? And also addressing upfront data security, saying, look, we know you have data privacy and data security concerns. Here's what the application has in it, or here's what we're doing. Any demo, just explaining this is how the data is safeguarded will help increase trust in those tools. And that's it. Thank you very much. I look forward to your questions.
Thank you,
I guess I turn it back to
Michelle.
Stella.
Thank you, Michelle. You can access Culture IQ's full report, What Californians Are Saying About AI in Healthcare, on the CHCF website. We'll share the link in the chat. We'll now move on to our panel discussion, where we'll hear from organizations implementing AI today and their considerations for building patient trust. I'm excited to introduce our panelists today, Alifia Hassan, Innovation Portfolio Manager at the Duke Institute for Health Innovation. She leads Health AI Partnership, which supports healthcare organizations to implement AI safely, effectively, and equitably. We'll also have Sonia Tucker, VP of Population Health at San Ysidro Health, an FQHC that serves more than 160,000 patients in San Diego near the Mexican border. San Ysidro Health has implemented a range of AI tools, and I'm particularly excited to have them both today as they collaborated on an implementation of an AI tool to screen for diabetic retinopathy at San Ysidro. Welcome. So to ground us, could you both talk about your experience with AI implementation? Alifia, maybe I'll share this question with you first.
Yeah, thank you so much for having us. This was very interesting talk and very important work. So I actually sit within Duke Institute for Health Innovations, which is an innovations office for the Duke Health Systems. What we do is work with frontline clinicians to identify pain points at the front lines and collaboratively build AI ML-based solutions or technology-based solutions to solve those frontline problems. And we are very focused on implementation of those solutions within clinical workflows. So we've learned a lot over the past 12 years of doing that work within DHI on governance practices, on ensuring transparency and trust, on ensuring education for frontline clinicians, as well as patient disclosures wherever that is appropriate. And how do we ensure that these solutions that we're building actually work within the clinical workflows and solve the problems, otherwise they won't get used. And I also, additionally to that, I also lead Health AI Partnership, which is a multi-stakeholder collaborative that thinks about AI best practices and lifecycle management and governance of these systems across all institutions. So we talk to other AMCs, we talk to hospital systems, we talk to FQHCs and smaller rural clinics, and understand what are they doing, what are their pain points, and what are their challenges, and sort of surface guidelines, best practices, and frameworks for implementation support. Thank you. Yeah.
Go ahead, Sonia.
Okay, perfect. Thank you so much. So let me see, let me see if I remember the question. So what was the experience that I have with AI implementation? So yes. I work with Alifia in the implementation of diabetic retinopathy. However, that's not the only experience that San Ysidro Health has had with AI solutions implementation. So I can tell you that I have, before we implemented our diabetic retinopathy point of care solution, we've had other experiences at using AI solutions more on the administrative side. And I've had an experience, an array of experience, what works, what doesn't work, how do we do it? And we've learned from our experiences. And I love the talk that we just heard, because I think, there were very key points that we were able to also identify as the beginning of our work with the AI implementation. I can tell you one area as a provider that you want to have is definitely an AI governance group before you embark into anything related to AI. I think it's important that you keep, key stakeholders in the middle of the implementation, because you need to hear the different perspectives, especially with the hesitation that could be not only at the patient, but also at the provider level. So I think, listening to what they have to say and trying to come up with solutions is an area that is extremely important. The other part is, one thing is, let's not use AI because it's, and I think I saw a question that is the buzz of the month. No, AI, we need to have a really, and this is what San Isidro Health is very conscientious on. What do we need a solution for? It's not because it's the word of the day, it's because there is something there's a gap that we need to fill. And, how can we fill that gap? How can we help our clinicians to be more effective? I think that's the most important part that we learned through the implementation, not only of our diabetic retinopathy work, but also in other cases.
That's super helpful to hear. And so I'm curious, are there lessons from the implementation you collaborated on or others specifically on building trust with patients? Like what worked well, what didn't? Would love to hear more on that.
Yeah, so let me start, Alifia. I'm gonna take the thunder from you. So I can tell you the first thing is, and I'm gonna focus specifically on our diabetic retinopathy work. Out of the the areas that we learned, definitely keep your patients and your stakeholders as part of your implementation. We have the tendency, especially if you are at a at a higher level, to like, okay, let's just do something because we need a solution. But I think it's important that we keep all the stakeholders on the same page, that we listen to them. Start small. If we have a problem, you want to go start fast. That's definitely something that we want to do. But we need to keep in mind that sometimes the AI solutions it might sound great in paper, but you need to see how your AI solution really works with your patient population in this case. And really partner with your vendor. I have to say, we had a great partnership with, at least, for our diabetic retinopathy, we had a great partnership with our vendor, and also look to belong to organizations such as what Alifia works with, because what I might be implementing diabetic retinopathy, but there are solutions out there or other work that has been done where you can learn also from what other people have done. So I have to say, being part of the cohort that I belong to with Alifia, I was able to really take some of those lessons learned from other people in the cohort and implement it into our own organization. And that's how we created initially. I said we didn't have initially an AI governance group. We were able to get some AI governance group guidance from that group to be able to implement it, because it is important not only, are we addressing HIPAA, but also how are we how are we saving that information? What are we saving? What do we do in this case? So we need to have a multidisciplinary team to be able to do something that is efficient and that is safe for our patients and providers as well. So I think those are like the main three different things. And I also think is, be able to, you gain trust as you work with the solution. So, definitely working as a team is extremely important. I don't know, Alifia, I'm sure you have a lot more lessons learned that you want to share.
No, I think that is great. I think with your, I think one thing that we learned as we embarked on this practice network where we worked with FQHCs to do AI implementation was like FQHCs are uniquely positioned to provide and gather patient input and build trust, because they're required to have patients as part of their boards, and their technology purchase decisions go through like this board, which has patient representatives in there. And I think when we work with Healthcare Partnership to surface best practice, we usually work with high resource institutions and AMCs, and they weren't thinking about like how to do patient disclosures and how to tell patients like what is happening with AI in big institutions. But very early on, FQHCs were asking, okay, how do I do disclosures? And how do I tell patients, like, well, how do I build literacy around this? And it was great to build that, work with them to ensure like there's information from the beginning. They're involved in governance and purchasing decisions. They're involved in disclosures and use, and they feel comfortable with whatever tool that is being used for whatever use case within their care settings.
And I want to add something, because there was a question on the chat regarding, how do we make sure that the AI solution is accurate? And that is, I think that's something that's important. Part of what we have done in our Federal Qualified Health Center is our provider, is the whole idea is to help the provider to make a decision on what's the next step for the patient. And the same thing with any other AI solution that you're implemented. The idea is to help and not to replace. And I think that's important that we let the patient know that your provider is still part of the mix. And I think if we make sure that when we're designing the implementation of the AI solution, that we are able to tell the patient or participant or whatever, it's like, there's going to have to be a review anyways of the information the AI is bringing in there. I think that's one of the areas that we learned, that the AI is not going to necessarily make the decision for you. Of course, it will be how you design it. That's how we design it. It's not an AI decision, it's the decision of the provider. It's just helping the provider to move a little bit faster to help what is the next step for the patient, and utilize technology for, I have to say, our providers count clicks on the EMR to have less clicks, so the patient is more efficient, the interaction with the patient.
It's great to hear that there's some already existing channels to engage with patients. It sounds like there are patient advisory boards, but I'm curious, like specifically around AI implementation, were they a part of the formal AI governance committee? Is it that they know it exists as a part of the consent process? Yeah, just curious if you can share more about how you engage them in implementation.
Yeah, so for us specifically, and I'm going to speak, about our RCT, we did invite patients that were technically able to qualify for the RCT. So ours was an RCT, but we learned that we've done patient advisory boards for different implementations of other solutions, not necessarily only AI, but other solutions that we've done in the organization. Also, what Alifia mentioned, our board was very informed, and 51% of our board, they're patients. So we also want to run that by them to make sure that that aligns with what they're wanting to see as patients. So we did invite them, and we had sessions specifically for our boards and for our patients, and we explained to them what the RCT or the solution was about, what is the purpose of the solution, why do we want to do. It's not because everybody's talking about AI right now that we want to go into AI. The reason is because we have either a shortage of providers, or because there is no communication between the specialist and the provider, or because we want to make sure that the provider spends a little bit more time with you. So we will use this to streamline the workflow of the referral. So we had, I believe it was 3 or 4 groups, where we invited the patients, and the patients were able to opt out if they didn't want to be part of it. And we collected feedback from the patients before, and this all happened before that everything was implemented. And then after the feedback was collected, so we were able to take that data, analyze the data, and form decisions also regarding depending on what the concerns were. So in fact, we were able to, I think our presenter was talking about education. We created educational materials explaining how the solution was. We worked with the vendor. Our vendor was very good. iArt was magnificent at providing the information that we needed at the time. We informed our patients that this was an FDA clear solution, meaning we needed to really work, that we could use it with them. So I think there was a lot of work done, but ultimately what we got was great results.
That's great. And you mentioned vendors as it's great to hear that your vendor was really engaged in supporting the patient education as well. I'm curious, so, with vendors, with other strategies, like where are opportunities that you see to build trust with patients on AI? Is it in the consent process, education, opt-out policies? Yeah, curious where you see opportunities.
Alifia.
Yeah, I can take start on this, and Sonia, please feel to chime in. So I think, for example, for one of our practice network sites, North Country Healthcare in Arizona, they were trying out AI Scribe, and very early on, we helped them develop like a pre and post patient satisfaction survey, sort of like trying to understand what are their comfort levels with the use of AI and how does that shift, and also develop education material. So that's one place for sure. I think in terms of building trust, I think communication with the trusted provider and ensuring that, like, that human interaction doesn't go away, and answering questions for patients early on and anticipating those questions is key for ensuring and building trust. I think we've built a lot of like education and materials that is focused towards like end user, which is like clinicians or nurse or care provider at the front lines. Like, for example, Healthcare Partnership developed the model fact labels, which looks like a nutrition label and talks about what is model for and what is it used for. And we've been like iterating on how does that look like for patients? What do they want to know for a particular use case? Creating, patient-facing registries by health systems, that these are the tools that are being used for your care delivery, where care decisions might be made or your patient experience might be used by AI. I think some level of transparency, because this technology is so new and it's so dynamic, we're still figuring out like a bounds of this technology. I think that will go a long way in ensuring and building trust for sure. Anything, Sonia, you'd like to add? I think you guys.
You know what? I think you covered all. I have to say, in our case, something that I think is extremely important, and it was mentioned a couple of times, is taking into account, your patient's background. What language do they speak? What ethnicity they are? Because the education that you're going to implement, it can't just be a blanket for everybody, because as a social drivers of health person, as a population health person, you have to be able to really meet the patient where the patient is. So, and the reality is some patients are going to opt out. So that has to be something that it has to be upfront. The patient has to have the opportunity to opt out. They need to know that, we are going to use AI. In this case, there was a consent, because it's a test that we're going to do on the patient's screening. So that the patient will have to have the opportunity. But at the same time, it's also understand, what does the patient want to know? Does the patient want to know the whole background of the AI solution, or do they want to know how was that machine learning, if it was a machine learning use, what information was used to teach the machine learning? So it depends on really the solution that you're using. But that's why I think, partnering with your vendor, making sure that you are hearing the human in the loop, whether it's your provider, your patient, the vendor, and also making sure that your vendor has a scorecard where you are tracking the quality of the solution that you're utilizing, and that communication is important.
Yeah, I know we're almost at it, so I just wanted to add one more point on the human in the loop conversation, right? I think there's, yes, right now what is happening is we are making sure human in the loop is one way we monitor and maintain and govern these systems. But I think we have to also be careful going forward with human in the loop, not replacing a robust governance that organization and health system itself are responsible to ensure to put in place. So like, do you have governance systems that monitor and maintain these systems? Are you looking at it regularly? Are you tracking performance? Are you working with your vendors to ensure that performance doesn't drift? And are you ensuring that human in the loop doesn't drift also, like as people start getting used to the technology? So I think we have to be careful over there, but yes.
Yeah, Olivia, that's such a great point. And thank you both for sharing your experiences on the ground. I think it was super, super helpful to hear. So we are at the end of our panel today. So I want to In our remaining time, take some questions from our audience. I'd like to welcome back Michelle Cordoba, as well as Anna Fernandez-Rockwell, who is also a founding director at Culture IQ. Great. So let me pull up my questions here. So for both Culture IQ and the panel, what would you say to the audience who wants to introduce these tools into their clinic and to build patient trust, but they're sort of dealing with a ton of other requirements to implement AI? Like, is there a first step to think about this?
I think what I heard from the groups that I conducted very loudly was that they want to be informed and they want to know what it is. Because a lot of these people, even though they'd heard about AI, they didn't know exactly what it was. Like Michelle referred to in the presentation, they often talk about it as the robots. And so I think you need to start with education.
And I think that can be done in a variety of ways, right? That, I mean, you could have a flyer that just says like, how, and again, focusing, like one of the other panelists mentioned, on where the patient is right now. So, focusing on, so how can AI help you? Or what AI tools do we have that are helping you? Or AI in the doctor's office? I think somebody mentioned in the Q&A about having TVs. I've been to a lot of different doctors' offices that have either TVs or slide shows in the waiting room or in the actual exam rooms. There are companies that will create those slides for you. So it doesn't necessarily have to be, a huge video production, right? But the idea is to just to bring it up, because your patient's not going to bring it up on their own, and they're just going to sit with that distrust. They're going to sit with that uncertainty. So the more information you can provide and be a resource, the better it will be in the end.
Yeah. One of our site leads at UCSD recently just also published like an epic smart phrase that providers should be using when writing assisted AI assisted notes. So like, there are AI being used to like help you summarize and clean up notes or like provide history. And I think just even that simple disclosure in your patient facing clinic visit notes that, okay, we used a AI tool that was HIPAA protected, that was validated for this public use is good. Yeah, that sort of like builds trust.
Yeah, I think everything that you guys are mentioning is extremely important. Education, communication, information to our patients, and really making sure that they understand that goes down to their grade level. I think one area that my biggest pet peeve is, if you're going to create educational material, make sure that your patients will understand what it is, what they're reading.
Yeah.
So the next question that I have is also a question and comment. So where can we find that AI governance guidance that Sonia mentioned?
Alifia can give it to you guys.
I posted it on the chat. We just published a paper on a case study that we did with the Canadian health system to help set up their AI governance policy. That sort of also describes like the AI governance committee components and defines the people, process, technology, and operations framework, and defines what are the components and under those steps. Yeah.
And that's the one that we use here at San Isidro. Not everything was implemented because it was what helped us in what fit our needs at that point, but it is a very comprehensive tool.
Great. It seems like the speakers are talking about implementation in hospitals or large healthcare systems, but individual providers, particularly in rural or poor communities, really need tools to promote efficiency and accuracy. Are there platforms or implementation support for those individual practitioners?
I want to clarify. San Isidro Health is a big system. However, we are in rural communities, and Alifia was mentioning an example of a rural federally qualified health centers in Arizona. So I think it doesn't necessarily mean that because you're bigger that you cannot adapt it if you need it in a smaller setting. I think ultimately when we're talking about patient education, you don't have to have big screens. You can have, we also have, especially for our rural communities, we have a one pages that are easier and for our patient population. So San Diego County is a very diverse group, a very diverse patient population. So we also have it in a way that everybody would understand, whether you speak English as a primary language or you have English as a secondary language, and your level of education is not that high as a patient. So we, or whether you're here in San Diego County or in a rural community, can be used. So I think it is important that we kind of think about what resources you have and how you can tailor it to the area, the resources that you have.
This question is for Sonia. So do you have data on accuracy and cost efficiency? Imagine for the screening tool, or if there's any data that you have against any of the other.
So keep in mind that this is an RCT. So we are in the midst of wrapping up our RCT. So we're still, looking at the data. We do have data. And in fact, our RCT workflow was published in JAMA. So if you guys want to go read our workflow, is right there. There is more data coming. I can tell you guys right now that the preliminary results are looking really good. In regards to cost efficiency, that's an area we definitely need to. There's an area for improvement, not because it is inefficient. It's just because as a federal qualified health center, if you're using a tool without a provider, it is non-reimbursable. So what is really the efficiency that this is bringing is efficiency in the workflow for the provider, and how we are expecting to reduce the number of unnecessary referrals to specialists when we could potentially keep the patient into a level of care that is a little bit cheaper. So instead of sending the patient to an optometrist or a retinologist, we'll be sending the patient to an ophthalmologist that's local. So that's the information we have. So we're still looking at that information right now and analyzing it.
But we, for Health Day Partnership, right, when we did the practice network with our other site, Arizona site, which did AI Scribe, I think our practice, our partnership key decision point guide that defines AI life cycle also has a lot of information around how do you define metrics for success and track them throughout the implementation to track are you being successful for the goals you set, and is that leading to cost efficiency, ensuring that you're actually solving the problems on the ground. So we use that to build metrics for Arizona site around their goals were to ensure physician burnout gets reduced and note writing time gets reduced, which was very successfully achieved. And they also found they found efficiencies around coding visits also because of the AI Scribe. So that's another way we're actually actively also working on understanding frameworks for ROI measurements for health AI tools as well. So I think that work is underway.
Great.
Yeah.
So for my next question, I'm going to try to combine a couple that I'm seeing in the Q&A. So thinking about, how do we tailor explanations of these technologies without overwhelming patients as there's so much around data security, how the AI is being used, accountability, what happens when the AI is wrong? And then we had one around how do you address questions on AI specifically for communities like in senior and underserved where potentially the burden of that explanation is even more challenging. So I'll share that question out to all the panelists.
Yeah, so I think the kind of the questions that I saw about AI literacy, I think, it wasn't in this presentation, but I think it's in the full report. One of the recommendations that we had for AI literacy overall, especially among senior and non-English speaking communities, was to partner with groups that are already working on digital literacy, right? With those groups, so that the digital literacy could, or maybe they're not, but they're doing, they have other support groups, support classes for those populations. That we could include digital literacy and an explanation of AI or a tutorial on AI more than an explanation. Because I think a lot of people, can understand it better if they have their hands on it. So maybe explaining what, ChatGPT is, or showing them how to use a translation tool would help them understand, kind of the practical nature of it. And rather than providing an explanation, and I think we've touched on this a couple of times, sometimes the explanation is more confusing than the thing because it's translated very poorly or translated very technologically. And so it's, whether it's in English or a non-English language, it gets more confusing than the actual tool, right? So being able to get some hands-on for people who don't have that experience with a ChatGPT at work or school, or don't have experience with anything more than kind of your basic Google Translate. I think that would really go a long way, some partnerships with the community at large, even in those, especially in those rural areas, or underserved communities, to help kind of make this more of an everyday thing and not such a scary other thing.
Great. I think we're now at time. So thank you to everyone that joined to share your insights and expertise today, and to everyone in the audience for joining us and engaging in this very important conversation. Before we close, please take a moment to complete the brief survey that would automatically launch when you exit this webinar. Your feedback is invaluable and helps us shape future programming to better meet your needs. We will also send a follow-up email with all the resources that we shared today and the recording to this webinar. And so with that, thank you again. Really appreciate you all for being here, and thank you for joining us.
Thank you.